useful. This is going to be both for providers and for nurses, as there's pieces in here that I think are going to cover both. I'm going to do a separate one for providers for some specific workflows that happen just on your end. But here, so the very first tip is favoriting the items that you're going to go to. So as soon as I go to my enter orders here, you'll notice that I have a whole bunch of things that are available to me. A care related order, some of the referrals that I might use, a urinalysis, a chest x-ray, which is a common thing. This Med Common Labs and Standard IV Fluids literally covers any blood work or IV fluids that you may want to do as a routine piece. It does have boluses and it has maintenance IVs as well. And then within that routine, you can select something. You can change the rates. If you want to change the rate on something, you go ahead and, select a different rate of whatever it might be that you want to do. And you can go ahead and order all of those things directly from your favorites page. You don't have to use your search engine. I also recommend when you're doing something in your, when you're searching for an order, if it's something that you're going to do fairly often and you realize that right away, put a star on it, and then you'll be able to save it to your main page, and eventually you should have everything you're ever going to need right there on that main page as part of your favorites, and it'll save you a lot of searching in the search engine. So that was tip number one. Tip number two, so whenever you're ordering something that is x-ray related, put in the prefix rad prior to the whatever item that you're going to x-ray. So here I have rad. As soon as I put in rad, it'll narrow it down to just x-rays, number one, which is already a bonus, but you can specify even a finger, and then it'll specify a finger there, or if you want to put in another body part, whatever body part it is, it will really narrow down your search to things that are practical for you. Otherwise, you might end up with a lot more items on that search that are confusing. So prefix rad. Tip number two, ED prefix, and search by the different diagnoses that you have here. It will give you the standard workup items that you should expect to see under that particular item. So this can be used again, inpatient nurses, your physicians might ask you to put in a chest pain x-ray or a chest pain protocol or something in the middle of the night for a patient. You can enter these as well under the ED. So that's tip number three. Menus. So that's where the PCA order is. It's under palliative, which is kind of a strange thing. There's also what's called a communication order. So anything that we want to communicate to staff, this is more on the provider end. So if you want to talk to your nurses and tell them to do something that doesn't necessarily pertain to a medication or a procedure that's within the orders, you can put in a communication order. And then when you have a communication order, you can actually put here. So I had previous example here. So whenever the patient leaves the unit, we want to check their IV sites or whatever, or patient may go for smokes, whatever it might be that you want to communicate to your staff that you normally would have written on your pink sheet as just instructions. This is where you can put that, and this will flow directly to the nurses as an order for them to check out, and they'll see this information. So valuable tool. Make sure you're not using this though to order things that should be ordered in a routine, like medications, IVs, or any specific procedures or tests. You do want to make sure you're ordering those appropriately. This is for those instructions that you may want to give to staff. Sources end of things, it'll make it a little easier to manage. So that's a little tip there for those medications when they were verified. So anything that the nurse clicks up here or the provider clicks when they add a medication list will get recorded in terms of that. You can also click on a medication name specifically and do an audit log. If you do an audit log, it'll also give you the information of who entered it, what was the source for the medication, and all that good stuff that we need to verify medication. So yeah, so you can also see the audit trail here. So if you put it here, you'll also see the source of the medication from here as well. So there's a couple places to click to really sort of verify whether those medications are accurate. Right here, you're going to put